Good day everyone, I'm Krisha Marie Pelga from SAS in Iloilo Batch 3. Today I'm going to perform the nasopharyngeal suctioning. The purpose of this is to remove the secretions from the airway and to facilitate ventilation and also to obtain secretion for the diagnostic procedure and to prevent infection. For the assessment, assess the client's level of consciousness, level of knowledge, and understanding, and then also assess the client's vital signs. Next, assess the client's breath sounds and the signs and symptoms of respiratory distress, and also assess the availability and functionality of the materials needed.
And for the planning, gather and prepare all the materials needed. The suction machine, suction catheter, B1 for the adult size, French 14 to 16, B2 for the pedia size, French 8 to 12, sterile gloves, irrigating saline or sterile water, large water or linen saver, tongue depressor, face mask for the protection if patients cough.
So for the procedure, in implementation, first you have to check and verify the doctor's order and then identify the patient.
Good day, Mom. I'm Krisha, your caregiver for today. May you state your name and your birthday, Mom? Okay, great. Then, explain the procedure to the patient. Ensure patient's privacy. Place a pulse oximeter on the patient's finger and leave the device in place. Next, you need to do hand hygiene. And put PPE as indicated. After that, you need to set the bed for comfortable height to work, and then lower the side rails where you will work. If the client is conscious, you need to position the client to a semi-Fowler's position, and if the patient is unconscious, you need to place the client in the sideline position, facing the healthcare. So first, I will help the patient into the semi-Fowler's position or help her sit up. After positioning the client, you need to place the drape or the clean towel across the client's chest. So for turning on the suction machine for the adult, you need 100 to 120 mmHg. For the neonates, you need 60 to 80 mmHg. For the infants, you need 80 to 100 mmHg. For the children, you need 80 to 100 mmHg. And for the adolescent, you need 80 to 120 mmHg. So for the portable unit, for the adult, you need 10 to 15 cmHg. For the neonates, you need 6 to 8 cmHg. For the infant, you need 8 to 10 cmHg. For the children, you need 8 to 10 cmHg. And for the adolescent, you need also 8 to 10 cmHg. After that, you need to put on the sterile gloves. Put on a mask, goggles, and face shield if splashing is likely. Prepare your equipment by connecting one end of the tubing to the suction machine. Turn the suction device on and set the pressure to the lowest level possible that will effectively clear secretions. So after checking the pressure by plugging the end of the tubing, place the open-ended tube near the patient within easy reach of your work area. Now prepare the suction catheter by opening the suction kit or catheter using aseptic technique. Fill the tray compartment with about 100 ml of sterile saline solution or sterile water. Open the water-soluble lubricant and squeeze into the open sterile catheter package. Be careful not to touch the package depending on your agency's policy. You'll now apply either a pair of sterile gloves or a sterile glove on your dominant hand and a clean glove on your non-dominant hand. Use your dominant hand to pick up the suction catheter without touching any non-sterile surface and use for non-dominant hand to pick up the connecting tubing. Attach the catheter to the tubing to make sure the equipment works properly. Suction a small amount of normal saline from the basin. Increase the patient's prescribed oxygen flow rate, instructing her to breathe slowly and deeply. Lightly coat 6 to 8 centimeters or 2.4 inches to 3.2 inches of the distal end of the catheter with a water-soluble lubricant. Mom, I'm going to go ahead and suction down your nose into your lungs to help get out some of those secretions. Using your non-dominant hand, remove the oxygen delivery device as the patient to inhale deeply. Use your dominant thumb and forefinger to insert the catheter gently but quickly into one of her nares as she inhales. As you insert the catheter, do not cover the catheter vent. Follow the natural course of the nares. Orient the catheter downward slightly. Don't force it. Inhale deeply. When you're performing nasopharyngeal suctioning, a good general rule is to insert the catheter to roughly the same depth of the distance from the mouth or tip of the nose to the angle of the mandible. In adults, that's about 16 centimeters or 6.4 inches. In older children, 8 to 12 centimeters or 3 to 5 inches. And in infants and young children, about 4 to 7.5 centimeters or 1.6 inches to 3 inches. Apply intermittent or continuous suction by placing your non-dominant thumb over the vent of the catheter for 15 seconds or less. At the same time, slowly withdraw the catheter as you roll it back and forth between your dominant thumb and then encourage the patient to cough. Replace her oxygen device and instruct her to inhale deeply. Assess more than 2 passes. Watch for alterations in the patient's cardiopulmonary status. When possible, allow adequate time at least 1 minute between suction passes to allow for ventilation and oxygenation. Rinse the catheter and connecting tubing by suctioning normal saline until the catheter and tubing have been cleared of secretions.
When you finish suctioning, detach the catheter from the connecting tubing. Loop the catheter around the fingers of your dominant hand and pull your glove off inside out around the coiled catheter to isolate any contaminants. Remove your other glove and turn off the suction device.
Are you doing okay, Mom? Perform hand hygiene and document the procedure, including your pre- and post-suctioning assessment, the amount, consistency, color, and odor of the patient's secretions, the size of a catheter you use, and the patient's response to the care.